Hello, everybody. I'm Amber, and this is my very first Emma Talks. I'm a longtime board member at the Environmental Media Association. And Emma Talks is a conversation series pairing entertainers and creatives, which I guess means me, and total rock stars of the world of innovation, business, activism, science, and health, all of which can be described to the qualities of our guests today. Our first guest is a professor of emergency medicine at the University of Colorado School of Medicine, chief of the section of wilderness medicine, which you'll have to explain, Jay, sits on the National Academy of Medicine's Roundtable on Environmental Health Sciences, Research, and Medicine, is a physician consultant to NASA's Human Research Program. I also need to hear about that, and an author, public speaker, and consultant for the CDC. Dr. J. Lemery, or as his friends refer to him, Dr. J.
Right.
All right.
Hello. Thanks, Amber.
Yeah. Will you, before I introduce Eric, will you just really quickly tell us what wilderness medicine is and NASA's Human Research Program?
Yeah. Wilderness medicine is just the art and science of taking care of people in remote and austere places. And
Okay.
so it's a little bit of that frontier medicine, but we're putting in 21st century medicine and hacks into it, ultrasounds and technology and things like that. So it's really how do we do that? And the straightforward practice is taking care of people in high, scary places in the mountains of the Rockies. But then places like NASA, want to tap into that field because they're like, look, we're going to start sending people to the moon for prolonged deployments. And they want to know, what do we need to worry about? What are the things that you think about in terms of risk assessment? What do we need to bring? What happens if something goes wrong? And so it's just kind of a different mindset to think about medicine when you don't have your big hospital, your clinic, or even your ambulance around you.
I just read actually that they were they're asking for volunteers to live in a 3D modulated simulation, um, Mars simulation for a year.
Totally.
Yeah.
That the design of that thing is awesome. I don't know if you saw it. It's just this cool little saddleback,
Size of like a,
Quonset hut.
right? It's
Yeah.
tiny,
Oh,
right?
it's small. Exactly.
Really small for 1 year. Thank you so much for explaining that. Along with Dr. J, we have Dr. Eric Balaban, and also Frontier Line Emergency Doctor and the 2021 Climate and Health Science Policy Fellow in the Climate and Health Fellowship at the University of Colorado, a group of doctors focused on understanding the impacts of climate change on public health, which we need so much today. So thank you so much, Eric, for being here. Should we call
Yeah.
Dr. Eric?
You know what? Just for the sake of conversation, Eric totally works. Let's do Eric. Hey, thanks for having me. Really excited to be here. Really excited to have the opportunity to work alongside Jay. And I'd hate to steal any of Jay or his fellow emergency physicians' thunder. So I just finished my training in internal medicine. I work right alongside those folks, but that's just the only thing that I would add.
What are you looking forward to getting out of this year fellowship for the with this group and what it means to work with climate and health?
Yeah. Can I be greedy and have two things?
Yeah, absolutely.
Okay, perfect. The first thing I really would like is to just understand more. Up until really about a month or two ago, I was kind of peripherally aware that the climate was an issue. There was a lot of scary talk going on, but I really didn't know much more than that. This is a great opportunity for me to really understand what's happening in the climate, what that means for me, and above all else, what that means for my patients. The second thing I really like, and this is, I think that the doctor in me is, I really want to help. And that comes in so many different forms. I think what the EMA does is a terrific form of helping. There are so many different organizations that are doing different kind of routes of attack to the same issue. I'm really hoping to pick up some of those tools of the trade and internalize them. So moving forward beyond this year, I can continue to help.
That's awesome. I believe we're going to need more and more doctors to have this knowledge, unfortunately.
Well, I think unfortunately, I think you're probably right. I like to think of it as a proactive step.
And actually, a lot of doctors should know about it even now with all of the changes we've already seen. But let's continue. Today, we're here to talk about one topic that everybody is talking about right now, and that we're literally living in. So, without further ado, I'm going to introduce the topic: the pandemic or pandemics. And I can't believe I said it with a smile.
All right.
So, Dr. J, can you actually give us a medical explanation of a pandemic? And since clearly this last year and a half plus now, we all think we're experts.
Yeah, there's a lot there, right? And it's something that has been bantered around by the media and warped, and everyone has their kind of own thing. But really, a pandemic, at its essence, is a scientific definition. It's a disease outbreak. There's kind of a few things we associate with it. It's a lot of people. Mm-hmm. It's widespread geography. So it's not just sort of an outbreak in a city with a poison well or something like that. It's widespread. It's persistent, and it's generally associated with the impact. It's got to be impactful for us to really give it that name, pandemic. And that's, I think, 600,000 Americans dead. That's impact. And of course, the world, much greater worldwide. Pandemics can extinguish or dissipate when it burns out on its own. Mm-hmm. This one hasn't done that yet. It's way too infectious, so it's still zipping around the world. When enough people get the disease, and it's called herd immunity. So around 70% is what the epidemiologists tell us we need, where it's harder to spread from person to person because persons in between have had the disease, so they're not going to spread it, if that makes sense. And then, of course,
the disease? Do you have to have the disease to start the herd immunity, or could it be also vaccination?
Well, right. Yeah, exactly. So the third thing is vaccines, right? So if someone has had the disease, so they have antibodies and some level of immunity, and another person has a vaccine, that in effect is two people who are not going to spread it as effectively or as wildfire as what we're seeing now.
I've so many thoughts and questions about that. I mean, you all must feel so much exhaustion from the last year and a half, and I'm just curious, how are you? I know this isn't really part of maybe what this is part of the conversation. How are you handling this fatigue mentally and emotionally, both of you, I think, because as healthcare providers, I can't even imagine what you all have seen. And I know, just being a regular person, I'm mentally fatigued. This new wave of Delta and it not stopping, and that we thought we were seeing, and we thought we might see an end, has kind of put a little bit of a heaviness in my mental state, I have to say. And just also grieving all the people we've lost. I lost personally 3 relatives, so I'm just curious how you all are taking care of yourselves.
Yeah. So it's a perpetual question. There's a lot of substance abuse, in medicine. So people are turning to numbing themselves. There's a lot of depression. I'll just say this because it's really important. My dear friend, we kind of grew up together in training, was Lorna Breen. the
Mhm.
physician in New York City who committed suicide after being completely overwhelmed in that first wave, which again was a beginning, no one saw it coming. So it's a perpetual challenge. I've been doing this almost 20 years, so I have strategies to keep resilient, because we see the worst case scenarios. But this, as you said, is worst case upon worst case on steroids, and now avoidable in many aspects, right? So there's another level of frustration as to why can't we get these straightforward messages across. So um, it is it's difficult, and I think I personally, lean on my wife and my kids and try to find those moments of just releasing steam in healthy ways, and try to get a little bit zen about my personal role as a clinician, which is like I have to go in there and I have to be on, and I have to be smart and rested to really do our jobs. Because, and again, it's not just the pandemic, it's everything else in emergency, in medicine, and emergency medicine, where people are coming in and they're having the worst day of their lives, whether you think they are or not. And so to be compassionate is a muscle that you have to practice, and it again, it's a challenge. So Eric, I'll turn it over to you, see what you think.
Yeah, it's been the first time I've experienced something like this. I'm kind of newer to the game, but even seasoned pros like Jay, this is not something that we're used to dealing with. Look, it's been hard, of course. It's been hard on anyone who's had to deal and see and work with the things that we've had to do and see and work with. I consider myself, and this is a little masochistic, and I certainly speak for myself, no one else beyond myself, but through all of the frustration and anxiety and heavy lifting that comes with this line of work, I've also simultaneously, I've never been more proud to do this kind of work. It has been an amazing opportunity to help. And that's one of the big, that's one of the two things I was hoping to get out of the fellowship. It's one of the big reasons I went to medicine. I know it's a lot of my colleagues went into medicine for similar reasons. It's a shame that I have to help in this way. And it's a shame that we have to continue to try to help this much when society has the tools to mitigate such a disaster a little further. But I'm glad that I'm in a position to try to help during a time where you need reinforcements when there's a threat this big. I'm really thankful to society. There are lots of signs. There's lots of, both on a personal and on a societal level, there's a lot of support for this sector of work. And that's thoughtful. But at the same time, I'll echo Jay and shamelessly issue a plug that if society really hopes to support the medical community, let alone support your neighbor and the rest of society, I would happily have them have the vaccination than put up a sign any day.
Yeah.
Well said.
Thank you all for that. I really appreciate it. Really, truly. You all are to me, you're just heroes. And I think most of us put you on pedestals and forget that you're human beings just like us. We think of doctors and scientists as which you are, these superheroes that maybe know are in touch with something greater than we are. And in some ways I do believe you are, but you're still humans who have to go home to your families and to your own hearts and minds. And so I thank you both so much, and your colleagues, for what you're doing right now. And I'm just really in awe. The IPCC, the Intergovernmental Panel on Climate Change, just released this updated report this week. It seems like things are getting worse faster than we expected. I don't know if that's necessarily totally true, because they've been saying this for a while, but for some of us, it might be newer news. Jay, I assume this is going to be bad for our health, and I'd love for you to talk about the implications of climate change on our health and what this really means for pandemics too.
Yeah, no, it's a great question. This report was a monster. So we are still dissecting it. Eric and I and the team met yesterday, and we're just like, where do we begin? So my hot takes on it are, first of all, it is a little bit important to remember who we are. We're healthcare providers, and this report was on the physical science of climate change. So although we are consumers of this report and applying it to healthcare, we are not necessarily experts on that physical science. So we have to sort of take from it where we can and put it into our own work, which is health. And that's a report coming down the pike, but this was the physical science one. I think the big thing is that, and the last one was 2013, so 8 years ago. 7 years ago, was that they said unequivocally this is human caused, and that may seem obvious, but we hadn't quite heard that from the IPCC yet, which again is a very it's probably where the best science on climate change is synthesized and resides globally. So it's a global report. So the fact that they unimpeachably said, this is our fault and it's ours to fix, was sort of a 1-2 punch that, again, we hadn't heard that strength of language before. So a couple other things. The thing that got me was the polar ice caps are gone. That is, and they used a phrase, it is irreversible at centennial timescales. So in hundreds of years, the polar ice caps are gone. So sea level rise is coming no matter what. And from a health perspective, think about all the people that live, work, eat, recreate on the coastlines, and that is going to be a truly an worsening existential crisis. But on the flip side, there was something with temperature and carbon that was very it was exciting to see, in that we still have time. And they really hammered home the point that that temperature and carbon sequestration the carbon economy are very closely linked. So if we can begin to transition and reduce the carbon economy, the temperature will follow quite precisely and linked with that exquisitely. So that to me was like, we still have time, and if we can begin to do that now, and they gave different scenarios, if we can be on those more optimistic or aggressive scenarios, we can avoid the worst case disasters and hitting that threshold that they said of a 2 degrees centigrade, about 4 degrees Fahrenheit increase in global temperatures, and avoid that disaster. So to me, it was like, okay, this is a scary report, but we have reason to be optimistic and lean in. And then I guess my final point is that I believe this report and the language around it is quite impactful, in the sense that the data is there. It's very well written. There's new advances to science where now we can attribute weather events like the heat dome that we just hit in the Northwest to climate change, where historically we couldn't necessarily say. We're like, well, it's a threat multiplier, we don't know. But now we're like, yes, there is a beyond a reasonable doubt that this could have never have happened without climate change. It's very powerful language. So my hope is that we can get it away from asking ourselves, is it really happening? We don't really know. The science is still squishy to say, it's happening. Okay, let's start talking smart policy. And then I think it advances our risk assessment and allows us to, through all the political discourse in America, to allow us to say, okay, it's time to talk policy. And I think we're starting to see some of that, certainly at the city levels, but even this week the infrastructure bill passed. And I think I would say that could be a little bit part of that, although I'm not a political expert.
Mm-hmm. And I got the report and I want to read it, but as a layperson, how should I read this? How should I start? Because I saw it and I was like, oh my God, this is huge. where do I start? And, what's most pertinent that I'm going to, can I understand it? And how, where do I read the whole thing? I think it's thousands of pages. So I did suggest on social media that people take a look, just at least take a look and get familiar with this, because there'll be more reports coming over the next few years, correct? So
there's two more pieces of this. This is the first piece, and there's two more.
So how does one, like, not a scientist,
Yeah, I mean, Amber, this is a big deal, right? It's hard. How do we digest this? The first thing I do is I go on Twitter and follow the people that I respect. I'm like, okay, what's the deal on this? And then, some news sites that I trust, I say, okay, what are the top 5 takeaways from this? And that's how I kind of begin, because it kind of sets your frame of reference. You're like, okay, all right, this is the thing. And then there's different levels of the report. There's the monster. And then I think there's a 40-pager that's the summary for policymakers, which you can download for free. And that's a big read, but it's a summary. And it doesn't get into the weeds and bog down. And it's elegant, it's well written, and you can even kind of pick and choose. And I'll just say, when you think about communicating science, some of the graphics there are very well done, very intuitive. Like, you look at the picture, like, okay, I get it.
Yeah,
you can see it right away.
I'll definitely read the summary. Thank you for that, because I opened it and I went, oh my gosh. And if I went, oh my gosh, and I care about this, subject immensely, I can't imagine how someone who's just trying to come into understanding climate crisis, how they would feel. And though this is, I know, extremely important for people to start really hearing and understanding, because we've been in a period where science has been told, we've been told science is fake news, right? And I think to turn people's minds back into the truth of science. Science is the truth. That's what we have it for. That's the cool part about science. So before I go anywhere else, I mean, Eric, would you like to comment on that and about the truth of science and kind of how we've spent this period of denying science, really?
Yeah, I've spent some time thinking about that, and it dovetails back, at least in part, with, I think, what Jay said. Science, for some reason, somehow we've gone to this really weird space where science is a pretty loaded term. It's kind of a charged term. I'm not exactly sure how we got here, but it is something that, the latest science is kind of like a trigger now. Those are kind of fighting words, which in its truest application is it feels really strange. And look, there's a lot of uncertainty with studies, with science. COVID, I think, is a great example. When you're presented with something truly novel, there's a discovery period. And we haven't had the opportunity to map out every consequential step of all of nature, body included. So there are still surprises out there. But we take a lot of caution in phrasing those uncertainties. That's exactly what Jay was talking about. For the past 25, 30 years that these reports have been around, the language has gotten closer and closer in confidence to being certain that these changes in climate are real and person produced. Up until the last report, where they used every word but certain. We are very, very confident. There is high consistency, just like all these equivocations. And for the first headline of this new report to come out as A1, Alpha 1 headline, first sentence, first syllables, there is unequivocal evidence. Really, that raises eyebrows in the scientific community, particularly in environmental and science, in medicine. Those are serious words.
Mm-hmm. Definitely. Thank you for that. Um, let's see. How do you, Jay, compare our history with, with what's when we're talking about the denying of science the last few years, and how do you compare that with and how we're dealing with it with all of kind of the widespread the people who are choosing not to get vaccinated, but also, you know, as Eric mentioned, like, we don't have the science on COVID, but then we've heard that we've been studying coronavirus, and then you've got all this mixed information. So how do we kind of compare what we know from old vaccinations working, science that we've studied on other viruses? How do we kind of bring that to people in a way so that people get on board and start making different choices? I guess I think that's we need some hope, and we need some, I feel like, some really strong actions. Is there a way
Uh,
to talk about the, even like the Spanish flu and
yeah, they're totally. It's America's healthcare providers. I mean, we're here for you. Well, let me dive into that a little bit. I think so. One thing we have to do is it's not just getting the message out; it's confronting crazy. Um, and there are these goofy theories that now, right? This is the paradigm of the last 5 years where social media is amplifying crazy to the point where these QAnon and other theories are locking in, and they spread like wildfire. They contaminate our ability to talk about sober science-backed messages, which historically we were decent authorities, your family doctor, your healthcare providers. Science isn't great at communication because science thinks about science, and science communication isn't necessarily what a funded researcher thinks about. And they have to equivocate, as Eric said, because they're on the vanguard of discovery. They're not talking about gravity. Gravity is now a law, right? We don't worry about that. We're talking about, does this therapy work? And it kind of does, but we're not sure. That's why we're spending a lot of time and energy thinking about it. But one thing physicians and healthcare providers, nurses, et cetera, are really good at is science communication. So a couple things. We still hold the public trust. When I say to you, Amber, you need this surgery, you got to take this medicine, generally our patients believe us. Second opinions notwithstanding, they say, okay, doc, yeah, I get this. We aren't necessarily trained in science communication. But let me rephrase that. When we're at the bedside, we are the ones to translate that abstract science of here's the pill you need to take because it unclogs the pipes, and the pipes open up and they get oxygen to your heart. And that's why aspirin is good for a heart attack. We also aren't trained to wait until we are 95% certain to act. And oh, by the way, right, healthcare is life and death decisions. So I'm not going to sit at the bedside with your family member waiting until I have 95% certainty to diagnose that patient with sepsis, to begin antibiotics and fluids. I'm going to look at all the data early on and say, I think this is sepsis. If I wait, it'll be catastrophic for this patient and the patient could die. But if I act now, we can optimize the outcome. And so I think your healthcare providers, we are much more comfortable talking about the science and the need to act, the imperative to do something now, because that's the world we live in. And so I feel like, and again, this has been our program, my career has been like, let's mobilize the clinicians to weigh in against all these crazy conversations happening, because again, at the end of the day, I think society still sees us as a little bit different. We wear that white coat from the funded scientists, and we know that we still hold the public trust.
Absolutely. And just out of curiosity, do you guys have any take on why there's so much kind of crazy nonsense and mistrust? And I mean, people need more mental health, or I kind of been questioning, like, why is this, what is the problem? Why does everybody, like, why is there's like a faction of like crazy opinions, and then there's people who seemingly are somewhat in touch with what's happening, and yes, they're having ups and downs with it, but then you have this, I just don't know what's going on and how to right the ship. And do you guys have any thoughts on that, and hope how we can, besides, getting rid of getting rid of social media?
What was Naomi Oreskes' book that she wrote about the tobacco industry and science? I'm totally blanking on that. Do you guys know?
It's not the one they made into a film.
It was I could Google it in 2 seconds, but but there's a lot, right? There are malfeasant players out there. The oil and gas industry, right, has been implicated in being very aggressive about squashing climate change. So Merchants of Doubt, that's the book. So
big pharma, right?
But I think I love that book because it really dissects the strategies around breaking down the convention and science-based knowledge, and how to warp science. And again, if you're in a conversation, it's very easy to say at any scientific convention you go to, is like, they don't know what they're talking about. Those guys were arguing left and right. They can't agree on anything. We don't really know. And if you don't understand the scientific process, or you're not invested in that, then the average uninformed consumer who may have a reason not to want a difficult change, and let's be clear, these are difficult changes, huge shifts in our economy and the way we operate. It's all too easy to say, you're right, we don't really know, and I like low gas prices.
Yeah. And I think even going beyond that, I think there's a lot of fear out there, and fear is such a powerful it's such a powerful and confusing factor, right? I mean, that's when you can take a sensible person, and even the most logical and cool-headed amongst us, when that person gets scared, whether it's for their health, their job, their family's livelihood, or whatever, logic all of a sudden goes to the back seat, and a lot of the conversation starts looking like what I think we're used to now, with a lot of even conspiratorial thinking, people accepting realities that may feel a little better, or any change. I think people tend to need to have a really good reason to change. I don't think it's necessarily in our collective consciousness or our inclination to spontaneously change. So the stakes are high, whether it's COVID or climate, and that scares folks. And I think that probably corrupts some reasoning out there that we would otherwise think would be kind of intuitive.
So true. So true. So Eric, why would you then, like, who's going to hire you to do this kind of climate work? And like, why would you want shift what you are doing in internal medicine and, kind of pivot a little bit, it sounds like.
Because it's a lot of passion-based stuff, but at the end of the table, you got to put bread on the table. People owe people money. Did my medical college ask you to ask me that, or my undergraduate university? Because that stuff's not cheap. But at face value, and this is I think the least flashy of answers, just to start with, I'm capable of doing what normal doctors do, working in hospitals, working in the clinic, tongue depressors, shots, doctor stuff. Something that I kind of stumbled upon in medical school was all the other stuff that doctors can do, and all the weirder places that we can kind of end up in. I mean, anywhere from advising policy, whether you buddy up with a congressperson or senator, continuing through the spectrum to making it your job. I mean, we think of Ben Carson, Rand Paul, just to name two of the most recent and high profile people. People in medicine can engage in heavyweight policy and politics. Beyond that, there's legal stuff. There are institutions, NIH, CDC, domestically and internationally, that that are forming multidisciplinary teams. And one of the seats, very near, if not at the head of the table, is an MD or DO, for good reason, because these folks are fluent in medical language and probably speak a little bit of other languages too. So I short term, I hope to find a hospitalist job and take this on as my responsibility outside the hospital. But there are plenty of hybrids that exist out there, where you see people talking on television or doing something in the community as part of an NGO, and you may or may not notice the MD after their name.
Well, anyone would be lucky to have you.
I appreciate it. I'll send you my CV if you want to help me send it out. I just moved and I'm looking for jobs right now, so
it'll be just fine.
Thank you.
I would just love to hear, and I think everybody else would love to hear. I know I've dug deep. Would you all like to leave us with a little bit of hope and joy with all that's going on? I think we could use it. So is there light at the end of this tunnel?
Yeah, I think so. I do. I think we're just getting to the point where we can actually do things, both politically. We just did a stress test and did proof of concept where we can spend huge sums of money to make a shift in the way we do business. We can do grand things like churn out vaccines. Despite all the bad press, we can make big societal behavior changes like masking. I think this report tells us there's still a window here for the really bad stuff. And I think that, to me, I'm like, okay, great. Let's do it. What I love about Emma is that we have all these different groups coming together, right? We've got here entertainment and medicine, but also business and even government officials. And I think that there's now a sense of like, we have got to get out of our silos, think about systemic ways to tackle this, and come together. With that said, I think there's many robust conversations to be had. The devil's going to be in the details, but I think now, the last 10 years, I've been talking about trying to change people's opinions on this from a health perspective. And now I feel like we can pivot to start talking about policy. And our role will be the health impacts of those policies, smart health impacts for, the resilience of our communities and the health and wellness of our loved ones. So I'm optimistic, and I think we're just beginning to really be able to see some meaningful changes. So I'll turn it over to you, Eric, to wrap it up.
Yeah. I probably should have started the conversation with a disclaimer that I tend to be an optimist, and we're just coming off the Olympics and I'm all fired up. So with that in mind, I'll say that, this report, going back to where we started with the conversation, this report is good news and bad news. The bad news is fairly obvious. It's there in bold text at the beginning of the report. The climate's getting warmer, the earth is changing, these changes aren't good for us, and they're going to be harder and harder to reverse. The good news, however, and this is, we save the good news for last. The good news is that we know it's there. When you identify the problem, you can have an honest shot at fixing it. And I don't take joy in saying that we have a climate issue, but when you internalize that, you can say, wow, we have a lot of tools to fix this. It's not something out of our control. It's not a death sentence. It's a problem. And we have not one, not two, but we have a multifaceted approach of how we can empower ourselves with trying to tackle this problem. So, I guess the punchline is I'm not glad it exists, but man, I'm glad that we know it's there. I know we can say no uncertain language that it's a problem, and I'm glad that we have the opportunity to intervene now. And I think that is where we need to shine the spotlight, is as quickly as possible get through this discussion of that this is a problem, and turn our attention to, guys, we have a real shot to do something incredible and incredibly proactive here.
Absolutely. Thank you all. Thank you both for that. That was really uplifting and hopeful. I'm gonna read that report, the summary for sure. So thank you. I'm just so glad to speak to both of you today. It was really enlightening, and thank you for being a part of Emma Talks and what you do for the community and the world at large. And yeah, much gratitude for what you do.
Thank you so much, Amber.